I've had an interesting career transition myself. I was an academic physician for most of my career, but there's a famous quote I heard very early on from Gertrude Stein: "A difference to be a difference must make a difference." And so I buy that, and I routinely take stock of not just what I'm doing, but what difference it's making in the world. And as a young, idealistic, energetic, newly minted preventive medicine specialist, I was going to be the guy that helped bend the curves. Less childhood obesity, less type 2 diabetes, less heart disease, less dementia. And here we are 30 years later, we have more of all of that. So my colleagues and I are not winning the war. And with Gertrude Stein's quote ringing in my head, I said, what we're doing isn't making the requisite difference. If there are new ways to try, I need to explore them, because I'd really like to make a difference before I'm done. So I wound up inadvertently becoming an entrepreneur at a late stage in my career, because I invented an entirely new way to comprehensively assess dietary intake, making it instantaneous and effortless. And the only way to get it to daylight, as it turned out, was to form a company. So I'm now a founder and a CEO of a company called Diet ID. There's a famous expression from the world of business routinely attributed to Peter Drucker: we don't manage what we don't measure. And the same is true in medicine, where the things that matter most, we measure in absolutely everybody. We compare those measurements to what they ought to be, and we know they're vital, and we call them vital signs. So everybody's had their blood pressure checked. Everybody. You don't have to try. It happens to you. It's passive. And it happens many times. And if those numbers aren't what they ought to be, it's a cue to action. The single leading predictor variable for premature death and total chronic disease risk in the United States today is diet quality, measured objectively. Full stop. Single leading predictor variable. And yet we measure it in just about no one, because the tools we've had aren't up to the task. They're too tedious, they take too long, they're too effort dependent, they're too unreliable, they're too costly. So we've solved that problem, and our mission is to make diet quality the vital sign it deserves to be. And frankly, we think there are almost limitless implications. If we could get that crucial information in front of every patient and every health professional, we think it would transform the standard of care. We're working toward that goal.